Hi, I'm Keith Argenbright, and I am a professor at UT Southwestern Medical Center in Dallas and the director of the Moncrief Cancer Institute in Fort Worth. And it's my pleasure to welcome you to the 2021 virtual meeting of Healthy Lives Matter. And I'm going to talk to you a little bit about prostate cancer today. And we're going to talk in several different topics today. We're going to talk about what the prostate gland is, what prostate cancer is, about the symptoms and the risk factors for prostate cancer. We're going to talk about risks and risk reduction, and then finally we're going to talk about testing today. So we have a lot to talk about. First of all, what is a prostate? A prostate is a gland that is part of the male reproductive system. It sits right underneath the bladder, and it is closely linked to the urinary system. As a matter of fact, urine actually goes through the prostate gland during part of a male urination. It serves as a part of the reproductive system because it actually makes the fluid so that sperm can move throughout the seminal fluid. And it's about the size of a walnut. So that kind of gives you the general idea of what it is and what size it is. Prostate cancer is an abnormal growth of that prostate gland. Cells in the gland itself grow abnormally and can cause cancer. And prostate cancer is actually the most common cause of cancer in men. And about 1 in 7 men in their lifetime will be diagnosed with prostate cancer. Unfortunately, it's a very insidious cancer, which means that a lot of men, most men, all men who have it in its earliest stages have no symptoms. And with all cancer, catching prostate cancer in its earliest stage is the greatest opportunity for a cure. And we'll talk a little bit more about that in just a few moments. So what are some symptoms that you might have problems with your prostate? Well, you could have some pain during urination. You could have increased urination at night, weight loss. You could have some weakness, stiffness in your back and pelvis. But I want to reiterate what I said earlier, that there are no signs of early prostate cancer. All of these are signs of prostate cancer that could have been progressed to a later stage. And so the reason that we do testing whenever you don't have symptoms is so that we can catch it early when it is curable. So am I at risk for prostate cancer? Well, prostate cancer tends to be more frequent the older you get. So the older you are, especially over age 50, sometimes even over age 45, and we'll talk about that in just a moment. If you've had a family history, especially with a father or a brother, even an uncle or a cousin can make you at greater risk for prostate cancer because of your family history, because we think there's a genetic basis to prostate cancer, and it moves through families. The ethnic origin, where you come from. African Americans are almost twice as likely to be diagnosed with prostate cancer as other ethnicities. And then finally, diet does seem to play a risk in all cancers, but prostate cancer in particular, it's very important to have the proper diet for that. How can you reduce your risk of prostate cancer? Well, first of all, getting regular exercise. That's with all cancers. Getting exercise, being physically fit is extremely important. Making sure you eat a healthy diet, and we'll talk a little bit more about diet in just a minute. And then finally, getting screened for prostate cancer. And I can't overemphasize enough that getting screened before you have those symptoms is really the best way, the only way to prevent you from having a bad outcome with prostate cancer. I've talked a lot about nutrition and diet being very important along with exercise. There's a diet that's called the Mediterranean diet that has been linked to reducing prostate cancer risks and improving the outcome for uh, people who have had prostate cancer. And the Mediterranean diet, it's pretty simple. It's loading up on lots of fruits, lots of vegetables, especially green leafy vegetables like you see here. Um, it's a diet that's very high in fiber with oats and grains and natural types of fiber. It's a diet that's lower in fat, in all kinds of fat, and then it's a diet that is very limited to adding additional sugar to the diet to your plate. Unsweetened tea, fewer desserts that have sugar in them, and it's not as heavy on the red meat. So if you look at this pyramid, it's really a diet that at the very bottom of the pyramid is based on fruits, nuts, and grains, and then you add in the next layer of uh, vegetables and green vegetables and tomatoes. You add a lot of seafood for your protein. You add some poultry and egg and dairy products, and then very limited amounts really of red meat. Red meat is limited to really one small serving of red meat per week. We try to avoid charred and smoked meats, really try to avoid the sugars, but really look at increasing the fish and the grains and beans and nuts in your diet. Let's talk a little bit about prostate cancer screening. You've heard me say it before. It's extremely important to get screened for prostate cancer, especially when you don't have symptoms, because early prostate cancer does not have any symptoms. You have to get a screening method. You have to get screened for prostate cancer through a blood test. It's called the PSA, and it measures a particular protein in your blood that is linked back to prostate cancer. And most healthy men have a PSA of less than 4. The digital rectal exam also is a way for feeling to see if there might be prostate cancer, but pretty much now it's the PSA that is taken on the most importance, and it's extremely important for you to talk with a healthcare provider, with your doctor or some other healthcare provider, to talk about you making the best decision that you can about getting screened for your particular condition, especially with your age and your family history. When should you start being tested? Well, we used to say age 50, but now if you're 45 with any sort of high risk, especially African American men or a close relative who's been diagnosed with prostate cancer, we're going to bump that down to 45 years old. And then if you have a very a high risk, and that's a men with more than one close relative diagnosed before the age of 65, we're going to start recommending that you get tested with the PSA at age 40. So certainly with some men we'll start at 40, but no later than 50. You should have already had at least one PSA to determine your risk for prostate cancer. So you're going to hear more about discussing your PSA results with a healthcare provider. You're going to hear more about the way that you can get tested, the way that if you're tested, you will receive your results back, and how we will contact with you with guidance if your PSA level is abnormal. But the most important thing is to get tested and understand the importance of testing, that even if you don't have symptoms, you need to be tested. So these are some additional resources. Obviously, it's always great to talk with your primary healthcare provider. There are other people that can help you both here in Tarrant County at the Public Health Department at JPS. We are standing by at the Moncrief Cancer Institute to answer any questions that you might have, and Texas Health Resources here locally in Fort Worth is a great resource, as well as the American Cancer Society. So Want to thank you very much for your time and your attention today, and wish you the best of luck as you determine how to get best screen for prostate cancer. Thank you.